Hello, I'm Alex Redmond, and welcome to MeTV's new show, Your Suncoast Health. By now, you may have seen the many commercials about hepatitis C. That's the liver disease, which left undiagnosed can lead to serious health problems, even death. But we've come a long way in both detecting and treating hepatitis C. And here to tell you all about the latest advances is infectious disease physician Dr. Vilma Vega of Community AIDS Network, or CAN, which is of Comprehensive Care Center. Welcome to the show, Dr. Vega. It's great to see you.
Thank you, Alex. I'm so excited to be here and talk about such an important disease.
Why is it that we've only seen over the past couple of years, or maybe 3 to 5 years, more and more hepatitis C commercials? What is it about hepatitis C that we find out now that we didn't know about years ago?
Well, it really has been within the last 2 years, and I would say it has to be because of the new innovative forms of therapy that we've got. We have a variety of medications that now are single-dose tablets, which make it very easy to treat hepatitis C, and it's curable, almost reaching rates of near 100%.
So with the prevalence of hepatitis C, we used to think that it affected mainly baby boomers, but who is affected by hep C? Right.
Well, the people that are affected, we do know that they are those baby boomers between those ages, the years of 1945 to 1964, but we also have the concerns of we've got an increasing rate of IV drug use in this nation. And certainly there's new rates of transmission in that way. The other ways are sexual transmission. There are still children being born to hepatitis C positive mothers, and that's 6 in every 100 children that are born to hepatitis C mothers are born positive. So we've got various other methods that people are getting transmitting hepatitis C, and that's why it's become such an important disease for us to test.
Now, if a child is born to a parent that does have hepatitis C, does that child automatically come up positive for hepatitis C? And if they get into treatment right away because they're just born, how would that help their chances of a possible cure or at least living in a better life with that disease?
Correct. In all pregnancies where a child may be born to a hepatitis C mother, you may actually still see antibody testing positive for the first 18 months. And that's why, in reality, it isn't until after 18 months that the child can again really be tested and see if they have chronic hepatitis C. But if they're treated early, we know that it's not only curable, but it'll prevent any chance of any long-term chronic toxicities to that liver.
So do you think that we know, is it because we have the diagnostic test that we're finding out that there are more people now with hepatitis C, or did we always have this problem and we just weren't able to diagnose it because we didn't have the tools?
I think it's a little bit of both. It really hasn't been until the 1990s that we really understood more about the testing. And it wasn't even until 1992 that even the blood and organs were being really tested for hepatitis C. So it's been really not around for that long. And so there have been people who have had hepatitis C who are now in their 70s and even 80s who did not realize they had hepatitis C. And so we're realizing that it's not just the old cases, but also now the new cases, not only the children being born, but also the people with the IV drug use. And also sexual transmission. We can't forget that.
Who is most affected, though? Is there a certain ethnic background that people are from, or a genetic? Is it that if your parents had it, are you more prone to it?
No, it's not that you're more prone to it, unless obviously you were transmitted because of a mother that was positive. But we do recognize that there are for example, HIV patients may be more at risk. We do realize that there are other disease patterns which can put a patient who has hepatitis C more at risk to develop complications from hepatitis C.
Is it people that have those autoimmune diseases that are more at risk? Because after all, HIV is human immunodeficiency virus, so other immune system problems that make you more at risk?
No, it's not necessarily more immune deficiency problems, but it's also the types of patterns of perhaps transmission, perhaps in an HIV patient, how they might have gotten HIV transmitted, maybe it put them more at risk for transmission of hepatitis C.
Are there other things that we might not think about, such as possibly sharing a toothbrush or razors or even tattoos that might make you more?
Certainly, certainly. Back in many years ago, tattoo was definitely a way of transmission. Even nowadays, I mean, certainly if they use equipment that might not be sterilized properly, it could be transmitted one to the other. But other ways is just the fact that. Sorry.
No, that's fine. So with the tattoos, we have razor blades. And how would that work, though, if you use that and someone's cut their skin and then they cut their own skin?
Correct. We have to really be careful. When we're dealing with hepatitis C, it's anywhere where there could be any type of transmission of bodily fluids, blood products. For example, let's say somebody who might have gum disease and might be using the same toothbrush. That could be an issue. And, we kind of say, oh, that can't be possible, but people do that. Same razor blades, it's absolutely, you should not be using the same razor blade as someone else. We never know when someone else might have hepatitis C.
And besides which, it's not hygienic anyway, so I mean, you're better off being safe. Now, what about certain ethnic groups or cultural backgrounds? Is there someone that's more at risk, like possibly, is it Caucasians, or is it the African American community? Who is most at risk? So everyone's at risk then.
Yes.
Pretty much. So,
everyone is at risk, and the thing is this: hepatitis C. I don't want to ever limit it to any one particular group, age. We've done this over the years sometimes, unfortunately, with other diseases such as HIV. And the reality is that we cannot ever think that hepatitis C is only of one particular group. It is important to get everyone, I believe that everyone should be tested.
And we're finding out more about this. We find out more about diseases as things progress. We find faster cures or faster treatments, better diagnostic tools. So we talked a little bit about genetics, and we talked a little bit about ethnic background. Everyone's at risk because if you have a risky lifestyle. But what about smoking or drinking?
Correct.
Can you explain how that might lead, gateway drugs even,
right,
into transmission?
Well, we know, obviously, let's just start with drugs. Besides the fact of IV drug use transmission because of needles, even regular drug use could put someone at risk because of risky behavior, such as sexual transmission. Then there's always alcohol. If someone has hepatitis C, then there is an increased risk for not only the hepatitis C to possibly get worse, but it's the liver disease itself. It takes many years for chronic hepatitis C to actually form into liver cirrhosis. However, when you add alcohol, it's like adding alcohol to a fire. You are accelerating it, and that's what actually can happen with the liver disease. Same thing with smoking. It's very indeterminate as to how much smoking affects the liver, but there are some research studies that are out there that show that perhaps people who are smokers are accelerating the amount of aggressive scarring of the liver.
Can you give us like a little trip through the human body about what happens through time when someone first gets hepatitis C and then how it leads to sclerosis of the liver, and what is that like? A healthy liver looks like what?
Right. Well, a healthy liver looks just like you imagine. All of us have seen liver when you're in the supermarket, and maybe you don't like the taste of liver, but you know what it looks like. It's that fleshy, very soft, and that's how it is. It's a nice rubbery feeling to liver. However, when it gets infected, it can take still quite a while from the time of progression, from the time of onset of the infection to the time at which it actually develops what we call cirrhosis, or a permanent hardening or scarring of the liver. It could be anywhere between 5 to 30 years, depending on how quickly it moves through that individual. But for the first few years, you may see just this mild inflammation. And perhaps you would not even know that it's there. But as years progress, it slowly starts building this scarring becomes more profuse. And over those 30 years, that pattern starts to form scarring over scarring over scarring until it hardens so much, because initially it might be just points of scarring, little scattered, what we call foci, or areas of scarring between the liver cells. But then over time, it's just the scarring becomes so significant that it basically becomes non-functional. And you know, your liver is important. You know,
what does the liver do? What does it do?
Well, the liver is a detoxification organ. It's very important not only for the management of your everyday life, your cholesterol formation, your hormones, all the parts that help you function in your body appropriately, but it also detoxifies the things that are not good for you. So all those toxins we put in and ingest every day, it tries to filter that out and get rid of it. It also filters out blood cells that are not appropriate, either too much or too little. It helps to regulate that as well. And when we don't have that, we can obviously develop that toxin buildup. And what happens with that? Your brain doesn't function well, and overall your other body organs do not function well.
Now, hepatitis C is one of the things that not every physician knows about it or treats it. Very often they will send their hepatitis C clients or patients to somewhere like us, which is CAN, a Comprehensive Care Center, and we will not only diagnose people, but we will also treat people there. So the question is, when somebody gets diagnosed with hepatitis C, how do you find out where their liver is? Is there a diagnostic tool that can stage where the liver is and you can do a baseline and then watch it from there?
Sure, Alex. There's several tools that we now use. There's some blood test tools that tell us as well the amount of advancing liver disease that's present. But there's also a new tool, it's called the FibroScan, and we're really fortunate to have what's called the portable FibroScan right here in the Suncoast area. But we really are able to send it throughout all our campuses to be able to evaluate the amount of scarring of the liver. Back in the old times, we used to have to do what's called the liver biopsy. And you can imagine just the word biopsy, you realize it's invasive. And it would lead to increased risk for bleeding and other complications, including significant pain from the biopsy. But now this FibroScan is able to evaluate just by what we call a shear wave. So it measures the wave resistance through that liver, and therefore we know how elastic or how easy that shear wave moves through the liver, and that will guide us as to the amount of scarring there is present.
Right. When people hear medical terminology, they get a little nervous because people aren't quite sure. We're not quite sure what something's going to feel like, what to expect. Can you give us a little window about
Sure.
what it would feel like if it's like an ultrasound, and what to expect when they're actually having the test performed?
Correct. It's a very simple test, and actually it's a non-invasive test, so there's really no pain involved, and that's really nice. And it's like an ultrasound. It's a probe, but it does make a certain sound wave, so that's what that sound wave is transmitted through the liver, and it's just a wand that's placed over the area of your liver, and then within a matter of less than 5 minutes, you've got your report, and it gives us an immediate result.
Well, how has that changed? Because over time, people had to wait quite a long time. What was the time limit on getting or the time frame on getting your results if you had a blood test years ago or a liver biopsy?
Oh, boys. It used to take us sometimes several days to a couple of weeks to get any result back that would give us the amount of scarring or problems within the liver. Now it's an immediate result, and for doctors that's great because you can order the medication right away.
Now, CAN, or Comprehensive Care Center, has more than 20 clinics here on the Suncoast. Which one are you working out of primarily now?
Right. I'm working out of the Clearwater office. I've been really fortunate to have worked in the majority of their facilities over the last few years, but at present time I'm stationed in Clearwater.
And of course, if somebody wants to have the portable FibroScan taken to their facility, CAN also partners up with other doctors on the Suncoast and actually throughout the state of Florida, and they will fly the FibroScan to that facility or drive it to the facility so that the physicians at that particular place can use it to help diagnose their patient or client, and also to tell them where their liver is, say, months from then, to keep a track of it, correct?
Correct. That's what's great. We were the first place to actually have a portable FibroScan, and that means we are easily able to send that FibroScan anywhere throughout the state of Florida, and therefore patients can go to the various campuses and they can expect to be able to get a FibroScan.
Now, over time, if hepatitis C goes undiagnosed and somebody has symptoms, what are some of the symptoms that they might actually be going through that might tell them that there's a problem? Because some people never think about getting tested.
Well, it's important first to know that only about 20% of patients who actually get hepatitis C at onset actually have symptoms. So 80% of people never even know that they were infected. And those 20% of initial cases may develop jaundice. That means yellowing of the eyes, yellowing of the skin. They may develop nausea, vomiting. Some develop fevers, joint pains, fatigue. But then over years, the acute disease obviously goes away and it becomes a chronic disease after 90 days. And after that, many people may not know for a long time that they have the disease. Some may experience some fatigue. They may experience joint pains and think that they have arthritis, but it may be caused by chronic hepatitis C. And then over time, after it progresses to the point of cirrhosis, that's where the real complications begin. They may have problems with their blood disorder, easy bleeding. They may have issues with abnormal liver function tests, which we recognize that. Clotting factors are abnormal, so you will see this again in your blood work. But then that's when you really develop a more significant pattern of the jaundice, which is the yellowing of the skin, and the distension of the abdomen. So you can actually have cirrhosis, which becomes uncontrolled, and therefore you get a late stage of this. And this is where you're seeing people who are having trouble to have to get a liver transplant. And by the time they have cirrhosis, that's what you're looking at, a liver transplant.
So this is something that can potentially kill you. So it's really important for people to get diagnosed and, of course, to get treated. And if you'd like more information about hepatitis C getting treated, you can go to Community AIDS Network CAN's website. That's cccSRQ.org. Again, cccSRQ.org, or go ahead and call. The number's right there on the screen, and we'll have that up again for you at the end of the show. But I think it's really important that people understand that you can not only get tested and diagnosed, but you can also now get treated. So it's very important. And let's talk about how treatment has changed over the years. Let's start with how treatment was with things like interferon and what that did and why people are resistant to that type of treatment.
Right. I remember back in the mid-1990s having to treat patients with interferon, and even as physicians, we would always cringe just at the thought of having to give them the treatment because it was so difficult. Patients would develop tremendous amount of fatigue, depression, anxiety. Their thyroid numbers might become abnormal. And then not only that, they'd have more increased risk for bleeding and blood disorders. It was just not a happy campus. And then not only that, it was the fact that the rates of cure were so low compared to what we have now. Back in that time when we were seeing HIV and hepatitis C patients who were infected with both diseases, the rate of cure was actually 10% only. Do you believe that? I mean, now we've got almost near 100% cure rate with the new medications we have. So it's such a big difference.
Were there patients that would actually not even come in if they thought that they had hepatitis C, or that once they were diagnosed possibly said, you know what, I'm not going to even bother with treatment because I know that the side effects are so harsh?
Correct. And we had patients who were treated who very often had to stop within the first 3 months of treatment, and then they just never did want to get to retried on treatment until now with all the new medications that are available.
After interferon, what was another type of medication that was starting to show promise before we get to where we are now?
Right. Well, we had protease inhibitors and we had polymerase inhibitors. So these are all different forms of attack of the virus with medications by mouth. But some of these were still used with the interferon because they were still not strong enough in and of themselves as pills.
When you say protease inhibitors, are those the same protease inhibitors that are used in HIV treatment? Or?
Well, they're not the same protease inhibitor. These specifically attack the hepatitis C virus, but it's by a similar mechanism of action.
Is hepatitis C and fatty liver and sclerosis treated the same way with the same type of treatment, or are they treated differently?
No, they're treated differently. We have now new medications that are coming out, and that's a whole new exciting field with fatty liver disease. And obviously we know with the obesity crisis in the United States that that's going to be much more prevalent concern for patients and how we're going to treat that. And probably there's going to be extra work for the FibroScan because we're going to be using that for a lot of these fatty liver patients. But it is treated differently, and these medications for hepatitis C are specifically triggered against the virus.
How does one get fatty liver disease? Is it simply from eating fat and fat accumulating in your liver, or is it something that someone can be born with or get from taking another medication or from another medical condition?
Exactly. There are some genetic predispositions for it. We do know that there are some patients who have the more risk for getting fatty liver even since youth. However, now the majority of our fatty liver cases are from the obesity crisis in the United States. It's the fact of high cholesterol and the way that we eat, the processed foods, and the high saturated fats. But in addition to that, we've also got our medications. And unfortunately, many of our medications also can add to problems. For example, in HIV, where they cause what we call metabolic disorder, where there's an increased risk for diabetes, an increased risk for high cholesterol. And those two factors of diabetes and high cholesterol can lead to increased fat accumulation within the liver.
So someone doesn't necessarily have to eat a very high-fat diet in order to have fatty liver disease.
Correct. As a matter of fact, there are people who are extremely thin. You look at them and you say, oh, they look very healthy. But in reality, their liver does not look so healthy, and they actually have abnormal liver tests, which is usually how you pick it up. Abnormal liver tests in your regular annual panel, and then the physician orders an ultrasound, and then on an ultrasound, they will see oftentimes fatty congestion of the liver.
In case you just tuned in, I'd like to give you the website again so that you can go online to find out where you can get diagnosed and treated for hepatitis C, and also to find out more about fatty liver disease and sclerosis. So you can go ahead and go to www.cccSRQ.org. Again, that's cccSRQ.org. And we are joined today by Dr. Vilma Vega, who is an infectious disease physician who works with both HIV patients and hepatitis C patients. And I can't thank you enough for all this great information, because a 30-second commercial just doesn't do it. We see the commercials about the medication, and people are very confused because WebMD is never the place to go, or Dr. Google, to really find out about what you should be doing. It's a conversation that you need to have with your physician. It's great to read up on things and ask your physician, but don't go in there and say, put me on this, because it may not be right for you, correct?
Correct. We recognize that there are 6 different what we call genotypes, or types of hepatitis C, and many of these have different types of medications that they work better for treatment. Therefore, it's important that the patient, not only as he gets educated, understands a little bit about the medications, but it's really the physician testing and being experienced to understand exactly what is the right medication for that patient.
So we talked a little bit about the medications of old, which were primarily just things like interferon, very harsh medications with harsh side effects. But now, Dr. Vega, if you could explain about the medications that we offer now, and how long people take these medications for and what they should expect in terms of results.
Right. Well, wow, it's such a wonderful thing nowadays. If you have hepatitis C, to be able to go to your doctor and say, I want treatment for hepatitis C, well, the doctor is happy to be able to prescribe now on almost all levels, majority of levels, a 1 pill once a day formulation. Unless obviously there are some cases where patients have more advanced disease and liver cirrhosis where they may need to be treated with 2 different pills. But the majority of patients are treated with 1 pill once a day, anywhere between 8 to 12 weeks. The majority of cases are 12 weeks. And some cases might be extended a little bit further because of liver cirrhosis. But the majority of cases now in the United States are treated with 12 weeks, 1 pill once a day, achieving cure rates of almost 100%.
And when you say achieving cure rates, do you mean a complete and total cure, or are we talking about just getting better and having to monitor that, every few weeks?
An absolute cure.
That's great.
Yes, and then when you think about so many other diseases that are caused by viruses out there that we do not have treatment for, wow, to have a treatment this good, and realizing that we've got 4 million people in the United States who are affected with hepatitis C. And when you realize this, then you say, wow, if I've got a pill that will cure, then we better diagnose you and treat you.
Well, we're coming up to the end of the show, so final thoughts. I'd love to hear you wrap it up and talk about with the people with the cure rate, because I think that's a positive note to end on. I can't believe that it's an actual cure rate in 2 months to 3 months.
Correct.
But is there hope that something else might come down that's even faster down the road because it's changing all the time?
Correct. There are treatments that are now being evaluated for faster, for less amount of weeks on treatment. And we realize that these treatments are expensive. That's why we're trying to find out ways that we can treat quicker with less medication. But the fact of it is that we need to understand that everyone really needs to understand their risk, needs to speak to their physician about hepatitis C, and should be treated. Similar, like I always preach about HIV, you should get tested. And the final thing is to say, without treatment, your risk could be as close to 5% of patients who develop liver cirrhosis can actually develop liver cancer. And this is the reason why we're so aggressive with treatment, because treatment reduces the risk for liver cancer and obviously reduces the risk for liver cirrhosis.
And again, how many people are out there with hepatitis C? You named a number before.
Close to 4 million people in the United States are infected with hepatitis C, and therefore it is important to get tested.
And those are only the people that we know about. So we are at the end of the show, but to find out more about being tested, diagnosed, and treated for hepatitis C, you can call or go to the web. Thanks to METV for helping to make this program possible, and thank you for watching. We'll see you next time on Your Suncoast Health.